So hello friends, now in this particular video we are going to start with the forensic medicine, another topic, that is your abortion. Okay, and this is a very important topic for your viva as well as your theory examination. Okay, abortion. So first I will define abortion according to WHO. So WHO defined it as abortion is expulsion or extraction from its mother of an embryo or fetus weighing 500 gram or less, okay, which is basically not capable of independent survival. So you have to speak as it is, the definition of WHO, okay, in viva examination or in your copy as it is. You have to write the definition, that is abortion is expulsion or extraction from its mother of an embryo or fetus weighing 500 gram or less, which is basically not capable of independent survival. Clear? Now what is the legal definition? So abortion is defined as expulsion of products of conception from the uterus at any period before full term. That is the legal definition of the abortion. Clear? Now first we will classify the abortion. Okay, so abortion first basis on the procedure, whether it is legally, okay, whether it is illegal. Basically abortion is classified into two categories. Okay, the first one is your natural abortion, it is also known as spontaneous abortion, and the second one is induced abortion, and it is also known as artificial. So natural or spontaneous, okay, and induced or artificial. Now this natural or spontaneous is made due to threatened abortion, complete abortion, incomplete. I will discuss, okay, in detail about natural abortion. Now so basically I will start with the natural abortion. So incidence is 10 to 20% of all the pregnancies, okay, and it is most frequent within first 3 months. Clear? And abortion occurs without any induction procedures, okay, and usually it coincides with your menstrual flow. Now what are the causes behind the natural? Okay, the first cause is genetic, and genetic causes comprises 50%. Okay, the second is your anatomic causes, and it accounts for your 10 to 15%. The third cause is your endocrine cause, and this endocrine cause account for 10 to 15%. Okay, the next is your infection, and it accounts for about 15%, and the last one is your immunological, that is for 5 to 10%. Okay, so these are the 5 basic causes behind the natural abortion. So I will discuss each of them. Okay, so first coming to this genetic. So majority of early abortions are due to this chromosomal abnormality, okay, and autosomal trisomy is the commonest one, and in that trisomy 16 is the most common. So this is your MCQ question. Okay, trisomy 16 is the most common. Monosomy and chromosomal aberration constitute 20% and 2% of all the abortion respectively. Okay, so first is your trisomy, then your monosomy. So monosomy is accounting 20%, and chromosomal aberration is accounting for 2 to 4%. Clear? Now coming to the anatomic. So cervico-uterine factors usually cause second trimester abortion. Okay, this genetic is basically responsible for first trimester. So if any abortion is occurring in first trimester, naturally the most common cause is genetic, and if it is occurring in second trimester, then the most common cause is anatomical cause, maybe cervical incompetence, congenital malformation of uterus, or uterine fibroids, and this. Okay, now endocrine. So in endocrine, diabetes mellitus or hyperthyroidism or luteal phase defect, so these are the reasons which are associated with the natural abortion. Now coming to the infections. So in infection, the infection may be virus, that is rubella, cytomegalo, megalovirus, or variola, or HIV. There may be bacterial infections such as ureaplasma, chlamydia, and brucella. There may be parasites such as toxoplasma or malaria. Okay, these are. Now in immunologically, so both autoimmune and alloimmune factors can cause miscarriage. Okay, so these are the 5 basic causes behind the natural abortion. You have to remember this trisomy 16 and all the 5 reasons for your theory examination. Clear? Now one more point, some other reasons are also there: maternal illness or anti-fetal antibody or blood group incompatibility. So these are the other reasons. Now coming to the artificial or induced abortion. Okay, so it means willful termination of pregnancy before viability. Okay, and it is again divided into 2 groups, that is legal or criminal or illegal. Okay, the legal, when it is done in according to MTP Act. I will describe MTP Act in a different video. Okay, and when it is not done according to MTP Act, that is a criminal. Okay, Now first we will discuss about the criminal abortion. Okay, criminal abortion. So legal aspects is dealing with the section 312 to 316 IPC. Okay, 312 to 316 IPC is related with the criminal abortion. Clear? Now coming to the first section number 312. So whoever voluntarily causes criminal abortion with the consent of the patient is liable for imprisonment up to 3 years. Okay, with consent of the man, then liable with the 3 years imprisonment and accompany with it with or without fine. Okay, there may be fine or there may not be fine. And if the woman is quick with the child, this is very important. If she is quick with child, then the imprisonment may extend it to up to 7 years and fine. Clear? Now the second is 313 IPC. So if miscarriage is caused without the consent of the woman, without consent of woman. Okay, if the miscarriage is caused without the consent of the woman, okay, whether the woman is quick or not, that does not matter. The person is punished with either life imprisonment or 10 years plus fine. Clear? Now coming to 314. So a pregnant woman dies from the act. Okay, this is if death of the pregnant woman occurring. So 340 is basically deal with the death of the woman. Okay, then there will be imprisonment for 10 years and fine, or there may be life imprisonment. Clear? So these are 3 law. Now coming to the methods for inducing your criminal abortion. So these methods are divided into 3 groups. Okay, we will discuss each of the group. The first is your abortifacient drugs, the second is general violence, and the third is your local violence. So first coming to the abortifacient drugs. Clear? So these are the 3 methods by which criminal abortion is done. Okay, the abortifacient drugs using by general violence or by local violence. So in this first we are going to discuss is the abortifacient drugs. Now most of the abortifacient drugs have basically no effect on the uterus or fetus unless it is given in toxic dosage. Okay, now it is usually used in 2nd month of pregnancy. The first is your ecbolics. Basically ecbolics increases your uterine contraction. Okay, and examples are ergot preparations, your synthetic estrogens, okay, pituitary extract, strychnine, quinine. So these are the examples of ecbolics. The second is your immunocox. Okay, these drugs initiate or increase basically the menstrual flow. Okay, and it includes your estrogen, borax. These 2 you have to remember. The third is your GIT irritants. Okay, they cause irritation of uterus, and it includes purgative like castor or croton oil. Okay, or magnesium sulfate can also be used. The fourth is your genitourinary irritants. So they produces reflex uterine contraction. Okay, and it includes your vial of turpentine and all this. The fifth is your drugs having systemic toxicity, that includes organic and inorganic irritant both, such as lead, copper. Okay, and the sixth one is your abortion pill, which is made up of lead or diphenyl ethylene. So lead or your diphenyl ethylene. So these are the abortifacient drugs. Clear? Now coming to the second group, that is your general violence. Okay, general violence. So this general violence is again divided into 2 groups, that is intentional or accidental. Okay, intentional includes severe causes. I will discuss some of them. That is severe pressure. Okay, severe pressure applied on your abdomen. Okay, woman's abdomen by kneeling or blows or tight bandage or massage of the uterus through abdominal wall. The second one is your violent exercise, that may be like horse riding, cycling, skipping, all these by cupping. Okay, you have to search what is cupping and you have to reply in the comment box what is mean by cupping. Okay, I am not describing the cupping. I asked you to reply what is cupping. Clear? Now the last is your very hot and cold deep bath alternatively. Okay, so these are the intentional methods which are coming under general violence to induce your abortion. Clear? Now moving to the accidental. So a general checkup in advanced pregnancy can produce your abortion, but if the fetus is healthy, then abortion will not occur in accidental. Okay. Now coming to the last group, that is your local violence. Okay, this is the last group, that is the local violence. So it is usually employed in your third or fourth month, okay, when other methods have failed. And here the interference may be skilled or semi-skilled or unskilled. So we will divide that methods in this category. Okay, the first one is unskilled interference, the second category is your semi-skilled interference, and the third category is your skilled interference. Okay, so these are the three categories: unskilled, semi-skilled and skilled. So in unskilled, the two methods are given, that is first is your self instrumentation and the second is your use of abortion stick. Okay, and in semi skilled, instrumentation or abortion pastes are used, or elm bark are used. Okay, slippery elm bark, or syringing is done. And in skilled, dilatation and evacuation method, or vacuum aspiration method, or your prostaglandin, electric current, these are, or intrauterine installation of the hyperosmotic solution. Okay, so these are the methods of the local violence. Clear? Now moving to the next. So what are the complications of the criminal abortion? We are discussing about the criminal abortion. Okay, we have discussed the methods, what are the reasons behind the criminal abortion. Now coming to the complications. Okay, so we are going to discuss the criminal abortion complications. Clear? So in that we will divide into two categories, that is immediate complications and there will be delayed complications. Okay, complications are divided into two groups: immediate complications and delayed complications. Now what are the immediate complications? So immediate complication, you can remember the trick VEH. The first is your vagal inhibition. Okay, vagal inhibition. The second E for embolism, and this embolism may be fat embolism, this embolism may be air embolism, this embolism may be amniotic fluid embolism. Clear? And the last is your H. H is for hemorrhagic shock. Okay, H is used for hemorrhagic shock. Clear? Now coming to the delayed. So delayed is basically related with the septicemia. There may be your pyemia, there may be toxemia, there may be local infection, there may be tetanus infection. Okay, so these are the delayed complication of the criminal abortions. So now do two more categories, that is your systemic complications and remote complications. So in systemic complication, the woman may suffer from jaundice, hepatitis, or renal failure, or endocarditis. Okay, endocarditis, or your pneumonitis. Okay, or pulmonary embolism. Clear? And remote complications are, first is your chronic pelvic pain will be there. Clear? Then there may be ectopic pregnancies, there may be secondary infertility or the depression. So these are the remote complications. Okay, these are the systemic complications. Clear? So this is all about your criminal abortion. Now what is one more important, what is the medical legal aspects? Okay, so the first point, nearly all criminal abortion takes place at about second and third month of pregnancy. Okay, clear? Now it is resorted mostly by the widows and unmarried girls in India. Okay, unmarried girls. Clear? The third point, there may be cases of fabricated abortion. Okay, rarely, but when a woman is assaulted, she may try to exaggerate the offense by alleging that it caused her to abort. She may acquire a human or sometimes an animal fetus to support the charge. Clear? So these are the medical legal aspect of the abortion. One more question usually asked in your semester examination, that is, what is the medical legal aspect of placenta? So basically it gives about the idea of length of gestation. Okay, it gives an idea of the length of gestation. It also gives an idea about the transfer of poison or bacteria or antibodies across the placenta. Okay, and in criminal abortion, pieces are often retained in your uterus. So these are the three medical legal importance of the placenta. Now the last and most important point that is usually asked in your viva and all examination, that is, what is the duties of a doctor in a suspected criminal abortion? Okay, in suspected criminal abortion, what are the duties of the doctor? So the first duty, he should ask the patient to make a statement about the induction of the criminal abortion. Okay, so the doctor will ask, okay, to make a statement, patient to make a statement about the induction of criminal abortion. If she refuses, suppose if she refuses, then he should not pursue the matter but inform the police. Inform police. The second is, doctor should keep all the information obtained by him as a professional secret. Okay, secrecy should be maintained. The next is, he must consult a professional colleague. Okay, he must consult a professional colleague. If the woman condition is serious, he must arrange to record the dying declaration. And if the woman dies, he should not issue a death certificate but should inform the police for the postmortem examination. Clear? So these are the 5 basic duties of the doctor in a suspected criminal abortion. Clear? Okay. Now the last part, that is difference is usually asked between your natural and criminal abortion. So I am going to discuss that, natural and criminal abortion differences. Okay, so the first point is cause. So in natural abortion, they are the predisposing disease which we have discussed. Okay, predisposing disease will present here, pregnancy in your unmarried woman or widow. The second is your injuries on genital organ. Okay, so genital organ injuries will be absent here, will be present here. Foreign body in genital tract will be absent here, will be present here. Fetal injury will be absent here, will be present here. Okay, so the third may be your fetal injury, then your foreign bodies in your tract. Okay, genital tract. So these are the 4 basic differences between the criminal and natural abortion. Clear? So this is all about your abortion. Okay, so thank you for watching. Best of luck. If you like the video, please subscribe our channel and support us. Thank you.